David fam, I wanted to show what a deep cavity looks like inside a tooth, and don't let this happen to you. Let's start with the orientation of how the tooth anatomy looks like. Most of the time, you don't get to see a tooth look like this. Even if we take photos, we don't want it to look like this. This is from a tooth that had been extracted with a deep cavity in it, and here's the nerve of the tooth. Here's the healthy dentin, which is a tooth structure inside. And then this is the healthy enamel, which most people are familiar with. So when we look at how the healthy side looks, it's very uniform in color. There's no strange colors or changes in shape or anything like that. But as we look over to where the cavity and the bacteria process is happening, you can see that the enamel, which is the outer shell here, which is outlined by my mouse cursor here, the enamel shell stops here and then it becomes the dentin. But in the case of a cavity, what happens is that the bacteria starts to colonize inside the enamel and starts to eat away at the enamel. And after it has bypassed the enamel, which is the protection for the tooth, it starts to spread a lot faster inside the dentin. And you can even see the progression towards the nerve. Likely this tooth was removed because it was so painful and so inflamed, and because it was infected by the cavity and the bacteria. So where do we draw the threshold of treatment? The threshold is right at the junction between the enamel and the dentin. Because once a cavity has gone to this point inside the enamel, it starts to spread so fast, but also your brushing, your flossing, your water pick, your mouthwash, nothing will be able to clean inside a tooth except when we do a filling, when we cut this part out. So we'll also notice that this cavity is forming on the side of the tooth, not the top, but the side. And that means it was right up next to another tooth that likely had a small cavity starting as well. Which means the only way to clean this surface from the bacteria, the plaque, and cavity is actually to floss. And to floss before it gets to this point. Because once it gets to here, the food is just going to go straight inside. So, in the event that we want to do a filling, we would have to make it about this size to cut out the majority of the cavity. And you'll notice that some cavity cannot be removed because it's right next to the nerve. And very likely, the cavity has already caused damage to the nerve. Everything will be sensitive after if it wasn't already to start with. So our goal is always to catch the cavity early, so that way when we do a filling, it's this size and not this size. When it's this small, we can catch it early by doing a few things. Regular cleanings and checkups. When we do a checkup, we can check visually if there is a cavitation or a hole inside the tooth. And with checkup x-rays that we do every 2 years or so, depending on the person, we can actually see the changes in the structure of the tooth using the x-rays. When we look at an x-ray, it may not always show how deep a cavity is, but it gives us a good idea. So make sure that you don't let this happen to you. Take care of cavities when they're small before they cause pain and before there's a risk of losing the tooth like this person had. Hopefully you found this helpful. There's a lot of information. Thank you so much for listening and watching. Have a good one. We're always looking to care for you and your smile here at Arbo Dental Care Bradford. Take care.